Two things we do for patients with chronic pain. One is to try to provide them as many resources for pain reduction as we can. And the other is to either wean them off or prevent them from going on dangerous, high-risk controlled medications such as opiates.
Well, in my case, I came up and saw the pain management clinic here. And my very first meeting with the doctor was, well, he said to me, "You're addicted to Percocet." And I just looked up at him and I said, "No, I'm not." And he pulled up a whole bunch of numbers and statistics that showed how much I had been prescribed in terms of the Percocet and the amount and the levels. And I said, "Well, let me explain to you how I use it." And I explained to him how I use it. Then he says, "Well, maybe perhaps you're not. But I think if you're not now, you will be." And then he said, "We have what's called battlefield acupuncture." And he gave me the literature and he said, "Read up on that." And he said, "Come back and see us, and then we'll take a look at some other alternatives if we can, some other type of ways to deal with the pain." So when I came back, I said, "Okay, I'm ready to try it." They applied the acupuncture needles in the ear, and almost immediately I started to feel relief of the pain. And then they said, "Well, we can put up to 5 per ear. Some people are happy with 1. I said, "No, let's go for the full-blown effect. I want all 5. My level of pain at the clinic that morning was about an 8.5, maybe a 9. And it just every day it seemed to be getting better. The last time I took a Percocet pill was in December. Since that day in December, I have not touched pain medicines that you see over the counter or even prescribed. I just don't need it anymore. So it was a replacement therapy for me. And I would tell anyone who's been living with chronic pain, give it a shot. It may not work for you, but if it does, you'd be surprised at how wonderful you feel. And you can get back to some kind of normalcy and get back the things in your lifestyle that you may have been missing.